I'm going to try and be really quick because this isn't really so much a piece of research as a implementation of research. As Naji said, I'm the implementation lead for the, I support Professor Naji Tabit and various researchers that have spoken today through the Applied Research Collaboration. And my role really is about trying to get this research into practice, really supporting people living with dementia and also their workforce. So as part of that, we have developed a resource. It's called My Choice, and it has been developed really because we consistently heard from our system partners and people with dementia that they go for their memory assessment, they get their diagnosis, but there's very little time for them to be given information about how to live well with dementia. And also perhaps that's not the most appropriate time anyway. We also know that the support for following a dementia diagnosis is inconsistent and really in a lot of cases very limited or even absent. And that this results in people not having the information they need, and also they're not being able to find sort of trusted information online. So a sort of common thing we were hearing was that people would get their diagnosis, they went home with a diagnosis of dementia and a carrier bag full of information or no information. And so it's all about trying to give people the right information in the right way at the right time so they can use it. So I'm going to really try and skip through all this, but we came up with a number of topics, and this was co-designed with people with dementia and clinical workforce and researchers. And we also added, as a result of our co-design, other areas such as how to claim benefits and the sort of process for getting additional supports, care needs change. And we used a format that was sort of initially sort of used by one of our local mental health trusts and the University of Sussex. So a sort of thumbs traffic light system to whether of the evidence was a good level of evidence, or there wasn't quite enough evidence to know whether something worked or not, but also if there was evidence that something did not work. And then also a blue star that any interventions and activities might help protect people against dementia as they age. So maybe thinking about carers. Interestingly, we identified additional areas such as hearing and vision, and again things like how to, accessing support for as care needs change. So those were added, and then we went through quite a few cycles of iteration. And then we asked some dementia support workers and people living with dementia for their feedback. So this is their finding. So overwhelmingly, they found it easy to use. They found the information helpful, and found it not so much workforce for care planning, but certainly for things like planning for the future, and learning new things. And I'm going to sort of skip through the feedback from the workforce, but overall, like I say, really quite positive. And then people living with dementia and their carers. So we've had 12 lots of feedback so far. And again, people found the information easy to use, easy to understand. And are intending to either use some of the recommendations or already using some of the recommendations and would use it to go back to in the future. The person living with dementia key comments were very mixed. I mean, there was mixed feedback about whether it was too much information or too little information, but that's kind of trying to find that balance throughout the whole process, really. Real concern that we signpost to dementia support workers and GPs when people feel like that's very, very difficult to access, particularly if people living alone. So quite specific comments from people living alone. So obviously Sarah's research is really important about how people access care without that support of a carer. We included nice recommendations where that was relevant, although some people weren't so keen on that, and yes, so overall very positive experience, and It's now just, I mean, I'm literally launching it today, so I'll pop the link in the chat. And I think I've covered probably most of what I've got on this slide. But apart from perhaps that the overall consensus from the feedback was this would be best given to people at or shortly after their dementia diagnosis. So people talked about having a lot of the people that reviewed it had had a diagnosis for 4 years, and so they would have found it really useful much earlier, and they'd kind of found quite a lot of the information, but through a lot of hard work over the years. I just want to say thank you also to Nick, our previous speaker, because and Dorina, but we've had this was a really nice collaboration to get this this booklet together and launched.